Hello, everyone, and welcome back to Atlanta Coast Aesthetics. I'm Matt with ACA, and joining us once again is Dr. Thomas Pane, Chief Medical Officer and founder of Atlanta Coast Aesthetics. This week's question comes from the Instagram crowd, and a question here, Dr. Pane, is gaining weight for fat transfer a bad thing? Sounds counterintuitive, but Dr. Pane, maybe you can explain if this is a good or bad thing.
Well, it's an excellent question. We get this kind of thing a lot. I wouldn't call it a classic, but it's an important question. And, I don't recommend somebody gets into an unhealthy weight range just for the purposes of cosmetic surgery, because we want this to be healthy. That being said, there are people whose weight will drift up and down, by a few pounds. And that can make the difference if they have enough fat available to do a fat transfer or not, depending on what areas we're talking about. I'm presuming we're talking about Brazilian butt lift fat transfer, where we want to have as much as we can available. Now, if you're in a healthy body mass index range and you can drift up a little bit and stay there, but you want to do that before the surgery, that's not a bad idea. Keep in mind that when the fat's transferred, it's going to go up and down with your body weight. More often than that, rather than gaining weight, I usually would say seek a consult with somebody that does this a lot. We don't mind you coming in to see us. But I've done a number of people going back years now that had been told by other surgeons they don't have enough fat available. And I would see them, take a look, assess it, and then depending on what they're looking to do and where they're looking to do the lipo, sometimes people just aren't comfortable doing lipo in the places you need to do to get the fat available. And I remember a couple of times we first started doing this, we were surprised at how much we were actually able to get. And now I started to look for these people. So I'll tell people, someone told you there's not enough fat. That may be true, but it may not be true. So at least give me a call, show me a picture or something like that. And if that's the case, then yeah, they may not be able to do it. But in general, it is okay to gain some weight for a fat transfer if you are staying within the healthy zone. But I don't recommend anybody eating real unhealthy foods that they don't normally do or gaining a lot of weight. That I don't think is good practice or good habit to be in. The fat that's transferred will also go up and down with your body weight. So if you're younger, and then as we get a little older, everyone puts on a couple of pounds, most of us do, then you're going to gain it back there too. So the fat that gets transferred is going to go up and down with your body weight basically forever. So you can keep that in mind, that this is not an operation that wears off or the effects go away or something like that. So a couple different points there, but that really a good overview of what we're talking about with that question.
Well, thank you, Pane, for your insight, and we appreciate your time, and we'll see you on the next question.
Great.